given that we know where the virus is to a certain extent, I mean, we know where it incubates and multiplies. We know that the people most at risk of getting this virus and dying from it are Americans in nursing homes. Testing in nursing homes does sound like a manifestly good idea, even if it is 2 months and 25,000 deaths late. Is it too late to make a difference now? Does mandating that testing sound like a good idea other than just to me? What would be needed in order for nursing homes to pull this off and for it to have the most beneficial effect? Joining us now is somebody who knows. Dr. Michael Wasserman is the president of the California Association of Long-Term Care Medicine and the medical director of Eisenberg Village at the Los Angeles Jewish Home. Dr. Wasserman, it's good to have you with us tonight. Thank you so much for coming back.
Thank you so much, Rachel, and thank you for calling attention to what is really a very important issue.
Well, part of the reason I wanted to talk to you about it is because you've had experience with this at the local level. The LA Health Director, Los Angeles Health Director, made a similar recommendation in Los Angeles County a couple of weeks ago. It seems to be the same kind of recommendation that President Pence made to governors across the country today. I wanted to ask you if there's anything we should know about how this has played out in Los Angeles that should inform what we should expect in the country.
Absolutely. It started to happen, but we haven't tested every nursing home in Los Angeles County in the last 2.5 weeks since that was supposed to start happening. And so let me be completely unequivocal about this. If testing is available, not testing nursing home staff and residents is both medically unsound and unethical. It is critical, and we need to actually start with the staff because, as you've mentioned, they're the vectors. They're the ones bringing the virus into facilities, and they're also the ones dying from it when it goes unfettered in one of these facilities.
It strikes me as notable that the White House surprised everybody with this advice today, that this was not something they had signaled was coming. It was not something they appear to have taken wide advice on. They did announce the formation of a long-term care sort of task force, but they don't even plan to meet for the first time until the end of this month, maybe. It appears that this was just sort of sprung on the governors today. And then the president verbally entertained the prospect that it might be a mandate for nursing homes at some point, but appeared to literally just be entertaining that idea for the first time because a reporter asked him about it. It makes me worry that there isn't anything behind this recommendation that is going to actually facilitate nursing homes getting the testing done.
And I couldn't agree more. This is what's been bothering a lot of us in the fields of geriatrics and long-term care medicine for over 6 weeks. It's one thing to say to nursing homes, we want you to test. It's another thing to actually have it happen. And in fact, I have had stories from many of my colleagues around the country of facilities, both nursing homes and assisted living facilities, either resisting or avoiding testing. And that is absolutely unacceptable. There is the federal government, the state and local governments, they need to be 110% behind testing in both nursing homes and assisted living facilities, and there should be no equivocation on this issue. And it needs to happen literally yesterday.
It strikes me that the reason that a lot of homes are resisting testing to the extent that they are is because they're afraid of what will happen when they inevitably get very high test results. I mean, if there was a clear expectation that if you test and you have to publicly disclose your results, it turns out you got a lot of positive tests, that means you're going to get help. That might reverse the resistance on the part of some homes to both do the testing and to publicly disclose that information. It seems like we need a universal expectation that this information must be collected, it must be disclosed, and that it will not result in punishment, it will result in assistance.
You know, on a certain level, I understand that facilities are worried that if someone finds out there's been an outbreak, that they might have some media coverage or whatever, but keep in mind, this is a virus that when it gets into a nursing home or an assisted living facility can have a 30 to 40% mortality rate. I cannot comprehend an ethical response to choosing not to test out of fear that someone will find out that you have positive staff or positive residents. To me, if anyone has a loved one in a nursing home or assisted living facility and they have the capability of testing, you should be literally screaming at the top of your lungs that they need to start by testing their staff and then by testing the residents, in that order.
Dr. Michael Wasserman, President of the California Association of Long-Term Care Medicine. Dr. Wasserman, thanks for helping us understand this. I think this is an important inflection point. Thanks for being here tonight.
Thank you so much, Rachel.
All right, much